upper flared portion. And this is a common place where they do bone marrow biopsies and transplants. Because it's flat bone, there's a lot of hematopoiesis taking place here. In adults, it's in the flat bones where you have a lot of hematopoiesis. And in particular, you've got huge amounts happening in the iliac crest. Okay? And it's easy access point to drill little holes in here to get bone marrow. Okay? All right. You also have some palpation points here. This is the anterior superior iliac crest and the anterior inferior iliac crest. The anterior superior iliac crest is an easy gynecological palpation point, but the anterior inferior iliac crest is difficult because it's deep. Okay? These are origination points for muscles we'll be talking about later. Okay? All right. We also have the auricular surface for the sacroiliac joint. Notice how rough and corrugated it is. That's to maximize surface area. So you get a very strong joint at that sacroiliac joint, because this is what basically articulates with your sacrum. So you have to have a strong joint there, because that connects, to your axial skeleton. All right. Okay. All right. The ischium, that's your sit bone. Specifically, right now you're sitting right here. This is the ischial tuberosity, and that's an origination point for leg muscle we'll be talking about later. So that's where you're sitting right now, the ischium. Okay, so that helps to tell you that this is the posterior side of the oxcoxal bone, and therefore this is the anterior side of the oxcoxal bone. Okay, which is going to help us determine which side, whether this is a left or right innominate bone, oxcoxal bone. Right. So this again, the ischial tuberosity is going to be on the posterior side. Okay. All right. So continuing to look at the ischium, this is known as the ischial spine, and it's also a palpation point. And this is the greater sciatic notch, the largest nerve of the body. The sciatic nerve passes through here. Greater sciatic notch, the ischial spine, and this is called the lesser sciatic notch, sort of logical place for it, but I'm not testing it. You don't have to worry about that. But just so you know, FYI. Okay? All right. Now, this again is the acetabellum, the vinegar cup, and this is the obturator foramen, which is the largest foramen in the body. But in situ, that is in its place, if you look anatomically in its place, there's actually a membrane that covers this. Okay. All right, that takes us to the pubis. Okay, so the pubis, this roughened area here is the pubic symphysis, and we have a superior pubic ramus and an inferior pubic ramus. These are typically what break when you break your hip. Okay. All right. So now, is this left or right? So your sit bone, all right, the ischium, specifically the ischial tuberosity, you know that's behind you, and you know the acetabellum has to be lateral, so therefore this is the left. Okay. And you see the pubic symphysis, right? That's going to be anterior, right? So therefore this is a left oxcoxal bone. Okay. And you'll be able to pick these up and turn them around on the practical. Okay. All right.
So this also a left?
All right, so for this, the sit bone, so that's going to be behind you, all right? The acetabellum, yep, that's a lefty. Okay, exactly. All right, so now the femur. Okay. Just remember F femur, F foot, H humerus, H hand. That's the way to not forget, all right? So here you have the head and the neck, so those are pretty simple. And in the head, you have what's called the fovea capitis. So there's a ligament there that tethers into the acetabellum so that this stays put. Okay. All right. All right, you then have trochanters. You don't have tubercles like you have in the humerus. You have a greater trochanter and a lesser trochanter. So think of the trochanters as like gigantic tubercles. And tubercles is like little trochanters. these are insertion points for muscles that are going to be moving the leg, which we'll be talking about. Okay? It's because of those tendons that are tugging away at them that they get bigger and bigger and bigger. Okay? And if you keep working out with weights, doing a lot of running, etc., these will just keep getting bigger.
The bones actually get bigger?
Yeah, because when the tendons pull on them, it actually generates charges, generates negative charges on the surface of the bone, which stimulates bone growth. It's called Wolff's Law, which we'll get to later. Okay. All right, now, if you pick up the femur and you feel the shaft, you can feel this very sharp line going down the length of the shaft. Okay, that's called the linea aspera. And the linea aspera is one of the easiest ways to determine that this side is the posterior side of the femur. So if you turn this so that the linea aspera is posterior, where it's supposed to be, and the head is medial, like it's supposed to be, you can then determine that this is a right femur. So you'll need to be able to do that, okay? Right femur, all right. There's other ways to tell this is posterior, but I'll show you that in a second, okay? But I think this is the best way, because you can, blindfolded, you can grab it anywhere and you can tell that's the posterior. Okay. All right, moving distally, we have, unlike with the humerus, we actually have condyles. We don't, remember the humerus, we have the trochlea and the capitulum, but here we have actual condyles, all right? So these are the condyles here, all right? So the way you distinguish the two is you have a medial and lateral condyle, and you can tell this is the medial condyle because it's on the same side. The ipsilateral side with the head, because the head has to be medial. So that's the medial condyle. And on the contralateral side, that must be the lateral condyle. Okay? And above the condyles, we have the epicondyles. So this is going to be the medial epicondyle, because it's on the medial side. And this will be the lateral epicondyle, because it's on the lateral side. All right, between the two condyles, we have the intercondylar fossa. All right, that's another way of spotting the posterior aspect of the femur, is this. You don't have it here. Here you have the surface for the patella, okay, which is the kneecap. Right? But I think the best way is just that line. It's like blindfolded. You grab anywhere, and you can feel it all the way down the length. So, okay. All right. So now moving to the tibia and the fibula. I will not give you a disarticulated fibula, so you don't have to worry about that.
This
But
one?
the tibula, yeah. So, but the tibia, you gotta know. It's an important bone. All right. Okay, so how do you distinguish left versus right? Okay, you need to be able to distinguish what's anterior and what's medial. So, the tibia is your medial lower leg bone. The fibula is your lateral lower leg bone, okay? So you know on the medial side where you have the tibia, you have the medial ankle, right? That's your medial ankle. It's called the medial malleolus. It's kind of like the styloid process, right? The medial malleolus. So this is the medial side, okay? This is the anterior side. And one way you can tell, I think the best way you can tell is, you know, your shin bone. This is your shin bone. If you ever feel your shin bone, you feel that very sharp line going down the front. I mean, almost you can cut with it. It's so sharp. This is the anterior crest. So therefore, this is the anterior side of your tibia. All right. So now you have enough information to figure out whether this is left or right. Okay, if the anterior crest is anterior and the medial malleolus is medial, this must therefore be the left tibia. Okay, so this has to be on the medial side, and this has to be anterior. So this is a left tibia. Okay. All right. They call this the tibial tuberosity. The patellar ligament inserts here. That's the ligament that goes from your kneecap to your tibia. And it's roughened here because of all the pulling, all the running and workout that this imaginary person did. Okay, so in males, the tibial tuberosity is going to be larger than in females, typically. Okay. Now, interestingly, with the tibia, you do not have epicondyles, you only have condyles. So the medial malleolus is on the medial side, so this is going to be the medial malleolus, the medial condyle, sorry. This is the medial malleolus, this is the medial condyle, and this is the lateral condyle. There's no epicondyles. Okay, the medial condyle and the lateral condyle. And between the two, you have the intercondylar eminence. This is where your anterior and posterior cruciate ligaments attach, which hold your knee joint together. Okay. All right. Okay. All right, let's go to the foot. Oh, we got an articulated one here. That's kind of cool. You guys got lucky. All right, so remember in the hand we had the carpals and the metacarpals. Here you have tarsals and metatarsals, so it's coming undone a little bit. Okay. So the bones that make up the arch of the foot, these are the metatarsals, and the bones that make up the ankle are the tarsals. So the tarsals and the metatarsals. Okay. Tarsals and metatarsals. The metatarsals are numbered from the great toe, which is number 1, to the pinky toe, which is 5. So this will be metatarsal 1, metatarsal 2, 3, 4, and metatarsal 5. Okay. So if I cover those now, you have the phalanges, and they're also numbered like in the hand. All right. So in the case of the hand, the thumb was 1, so here the great toe is 1. The great toe has a proximal and a distal, and then a proximal, middle, distal, and so on. Proximal, middle, and distal for the others. Okay. All right. Now, the tarsals. Okay. The tarsals are the bones of the ankle. Okay. The calcaneus is your heel bone. The calcaneus. That's the biggest one. And the talus or the talus, that's basically receiving the entire weight from your leg. Okay. So the tibia is bearing completely down on that talus. So it's basically half your body weight that's bearing down on there. So that's the talus and that's the calcaneus. The cubical shaped one, that's the cuboid. That's the navicular. And then you have 3 cuneiforms. Okay. The great toe, that's on the medial side, so that's going to be your medial cuneiform, your intermediate cuneiform, and your lateral cuneiform. Okay. So the 3 cuneiforms: medial cuneiform, intermediate cuneiform, lateral cuneiform, the cuboid, the navicular, the talus, and the calcaneus. Okay. There we go.